Welcome to the latest issue of our Mayo Clinic Proceedings monthly multimedia summary. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Here I am again, this time to tell you about the Editor's Choice and Highlights articles in the November 2016 issue of Mayo Clinic Proceedings. This month's Editor's Choice is an original article on the incidence and etiology of sudden cardiac death in high school athletes. This article was written by Dr. Kimberly Harmon from the University of Washington, Seattle, and colleagues from several national healthcare institutions, including Mayo Clinic. They identified 104 cases of sudden cardiac arrest or death, 35 of whom survived, in a prospective media database covering 7 states over 6 school years. Overall, the rate of sudden cardiac arrest or death in male high school athletes was 1 in 45,000. 80% of sudden cardiac deaths occurred during exertion. Men's basketball was the highest risk sport with an incidence of 1 in 37,000, and overall, men's basketball and football accounted for 57% of deaths. Based on the 73% of cases for whom autopsy reports were available, idiopathic left ventricular hypertrophy, hypertrophic cardiomyopathy, or myocarditis were present in more than half of the sudden cardiac deaths. The accompanying editorial, The Many Faces of Sudden Death, was written by Dr. Danielle Morin and Dr. Chip Lavie from the John Ochsner Heart and Vascular Institute in New Orleans, Louisiana. The first highlight this month is a concise review for clinicians on the dangers and management of benzodiazepine use in older patients. This article was written by Dr. Matai Marcoda and colleagues from Mayo Clinic in Rochester, Minnesota. This review is meant to help general internists and primary care physicians recognize legitimate reasons for prescribing benzodiazepines in elderly patients, barriers physicians may encounter when they try to change their prescription patterns, and evidence-based strategies for discontinuing benzodiazepines in older patients. The authors also discuss pharmacologic and non-pharmacologic alternatives for treating insomnia and anxiety in older adults. You can get up to 1 hour of CME credit for reading this concise review if you complete the appropriate documentation. Another highlight in this month's issue of Mayo Clinic Proceedings is a special article about the reconciliation of individual and population perspectives on disease screening. The article was written by Dr. Rachid Salmi from the University of Bordeaux and colleagues from several other French healthcare institutions. The individual perspective, of course, is based on the possibility of achieving better outcomes if a curable disease is recognized at an early stage. The population-based perspective, however, also takes into account the acceptability of screening procedures and the possible negative effects, in particular on people who end up not having the disorder that's being screened for. The authors highlight how simulating the effects of screening can help avoid biases in screening policies that are related to secular improvements of treatments and success of prevention. The authors propose that, from a policy perspective, recommending screening or prescribing a screening test is unethical if all possible shortcomings of the efficacy and success of a particular screening strategy are not based on the best available contemporary evidence. The third highlight in this month's issue is a letter to the editor on the potential impact of burnout on the U.S. physician workforce by Dr. Ty Chanefeld and colleagues from Mayo Clinic in Rochester and the American Medical Association. Based on published data on changes in emotional exhaustion in U.S. physicians, the authors observed that reducing work hours appears to be an effective individual strategy to reduce burnout for many physicians. However, the increase in burnout observed in U.S. physicians between 2011 and 2014 may have translated into a 1% reduction in the professional effort of the U.S. physician workforce, which is roughly equivalent to eliminating the graduating classes of 7 U.S. medical schools. This may certainly exacerbate the physician workforce shortage that has been predicted for 2025 by the US Department of Health and Human Services. So it would be great if physicians could be provided better options to prevent burnout than working part-time or leaving the medical profession altogether. And I bet you remember that you can access the highlights and editor's choice articles that we just discussed here on our website free of charge during the entire month of November. There is a lot of other free content on our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. We update the website very often and you can find something new and interesting almost every day. It would be great if you could stay in touch with us on Facebook, Twitter, and YouTube. On Facebook and Twitter, we keep you up to date on online first publications that come out on our website between the monthly issue updates and on news stories related to articles that were published in Mayo Clinic Proceedings. On YouTube, we provide video content such as full author interviews and also our 60-second video article summaries. Well, winter is coming. Now is a good time to rummage in your closet for those warm sweaters and down jackets, at least if you live near us. We will see you again in December.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.